I'll just let her introduce herself. I just wanted to congratulate her on her recent job placement, as you saw the email today. And I think she's the first one in January who got 2024 started for us. And it was not an easy road for her. But Swati, please do the honor, introduce yourself. I mean, I'm sure you have seen this video like this from other success stories million times before. So you know the drill. So go through the drill and let us know something that I do not know.
Hi, my name is Swathi, and I have done my bachelor's in India and my master's from London. And I have joined MediPharm last year. And
No, wait, repeat what you just said slowly.
I have done my bachelor's from India and master's from London.
Bachelor's in
And
what?
bachelor's in microbiology and master's from microbiology.
Okay, go
In
ahead.
microbiology, sorry.
Okay.
And I joined MediPharma last year, and this was like totally a new different path for me. I didn't know anything till I attended Abhishek Gaur's webinar. And after the webinar, immediately I decided to join the course. And from there, it took a little while to understand what's going on, what we need to learn, and everything. But overall, it was a very exciting experience with MediPharma. And after finishing the course, I have done what Abhishek Garu has told us to do. Exactly, I have done what they have said. I have gone through the LMS modules like n number of times. Even now, I can tell the sequence how the modules are in LMS, which page, which module is there. I can tell everything what he has said. I have done everything. And I got like 2 technical interviews, but one of them they didn't ask much. I think they already selected before my interview was done. They just gave a brief idea about their company. And this one, the place where I got the job offer from, this was totally a 30 minutes interview. They have to stop because it was the end of the day for them. They have to stop the conversation because they wanted to leave. So that's all about me. And if you have any questions, you can ask.
Yes,
Hi,
Swathi, congratulations. Can
you.
you explain more about the role that you've been offered?
It's a pharmacovigilance role.
Have you started working?
No, I haven't. They
Okay.
are still doing the documentation.
Okay. Thank
Hi,
you.
Swathi. Hi,
Hi.
Swathi. This is Dr. Mamta. Sorry for my bad throat. So you would say that is your strength for the interview is going through LMS several times.
Yes.
Okay. So this was a very new path, totally new path.
Yes. I didn't know
Oh,
anything about drug safety till I attended the webinar.
okay.
First few lessons were like totally new. The lingo was new. Everything was totally different what I knew earlier. But slowly I have gone through the LMS, each module like several times. I made notes, everything. I used to write the questions, what the instructors used to tell us during the class. I have done everything, whatever they have said, I have done blindly maybe.
Okay.
I have
So
followed.
can you throw us some of the questions from your interview, which you
Uh,
feel very specific or tough questions?
Actually, I didn't had anything in my job description. The job description was like a front desk receptionist job description. And I had 2 interviewers, and one of them was pharmacovigilance manager and the other one was quality control head. And they mostly asked about the QCing, how we
Okay.
do QCing, and there were some tricky questions where one of them asked, how do you do SAE reconciliation for the post-marketed products?
Mm-hmm.
So I thought maybe they just wanted to check if I know the process and if I know it thoroughly or not, that SAE reconciliation is not done for the post-marketed products. It's only done for the clinical trial. So mostly they asked me about the QCing and few questions from here and there, how we do the query generation, how many times we do the follow-ups, and what is the procedure for AESI, how do
Okay.
we figure out AESI, and it was all interlinked with QCing only.
Okay. So with no experience of this job, so you could easily go through the interview questions, right? So
Yeah,
they check also the experience of the candidate.
yeah,
Okay. So you need to be confident enough.
yes.
I think that's also the key.
Yeah, they mentioned in the beginning itself, whatever they were asking, they said we would like to know with the examples. If you can give us example how you solved that situation or how you handled that processing or anything, they were like, we are more interested in learning the examples, how you have done that particular thing.
So you're also prepared for that.
Yeah, if you go through the modules, the examples which the instructors give in between, you can easily copy and you can frame it in your own words, and you can come up with your own story and tell them.
Okay. Thank you.
It's not that difficult.
So my question to you, um, I know I'll not be that easy. I'll be a little tough on you. Is microbiology to pharmacovigilance. Um, so what made you think that you can get a job from microbiology back?
In pharmacovigilance,
Yeah.
maybe it's little easy because the most of the job description says they want the biology background people or some with some medical knowledge. Or other than that, the way they interview and all, they don't require any previous education background or anything. They are purely sticking to the pharmacovigilance only.
Awesome. So you kind of mentioned a lot about subject, and you went through the modules and you have written your notes and your preparation, your rigorous thorough preparation, all great. But what is something that is non-subject related that you had to overcome during the interview process?
They were like nothing actually. Everything was related to subject.
So they, like, you never felt like, oh, I'm not confident, or I don't have an accent, or I cannot have good vocabulary in English, anything of that sort?
No,
Because
no.
some of us are not as bright as you.
At least you should not say that.
No, I'm just telling you, because see, if you cannot talk, or if you have, your predetermined assumptions about your weakness, that will be not a confident booster. So sometimes you did not have it, but some of us may have it.
No,
Is this your first interview?
technical round, this was my third, but first one, after a while, when I got all the answers what the interviewer asked, I messed up big time with the first interview. But second one, I think they decided already before interviewing me that I think they have chosen the candidate. So they didn't ask me anything. They just asked me, how is the workflow, where I work, and are you willing to relocate? These were the two questions only.
So what was the difference in you from your first interview to this third interview?
Oh, what I understood after my third interview that I needed lot of preparation, which I might didn't do for the first interview, or maybe I didn't had much experience with the interview, so I don't know. Maybe I needed more practice and more.
I know
Yeah.
that you did not, you are yet to start your job in like a week or so, but do you think you're confident in sustaining this job?
Yes.
How?
The confidence which you have
I
built
think
up
I
in
think
us.
I think this interview is more tougher than your actual interview. I'll just shut up, but I'll give everyone a chance to ask questions. I'll come back. And you know the question I'm going to ask because I asked all the students the same question all these years. So I'll come back and ask the final question. But guys, go ahead, please.
Swati, I had a quick question.
Yeah, yeah.
Congratulations. And you said they asked you if you were willing to relocate. So is your job now not going to be remote, or are you going to be at a specific?
It's remote.
Oh, okay.
No, this position which I got the offer for, it's fully remote. But the previous one which I interviewed and I didn't get selected, that was a hybrid one. And
Oh,
I was willing to relocate. That's the only reason I applied also.
got it. And how many companies did you apply to? I missed that part before you got this job.
A lot. Every day, my only work was morning 8:30 till afternoon. I left to pick up my kids. The only thing was I'll go through each and every job portal, and if I find anything related to mine, I used to apply.
Okay.
In the
Gotcha.
beginning, I did maintain Excel sheet, but later on, I didn't feel like adding anything to it, so I just left it. But I have applied a lot. Not just me, there are like many other friends from my batch. We have been doing the same thing.
Okay, but you were sorry, go ahead. But you were interviewed. This was your second company that you got interviewed and you got hired. Third. Okay, got it.
So, Swati, I have a question. So, what were you searching when you were applying? What was the title or the words that you were putting in the search bar?
I have put drug safety and pharmacovigilance. And whatever I could see, I have applied.
Okay. Sounds
Entry
good.
level, senior level, anything. If it fits, it has some terms which my resume has, I have applied.
Okay. And what's your
There are few
job
positions
title?
which I blindly applied for CRS also.
Right. And what's the title that you're holding right now in your job?
Pharmacovigilance.
Just says pharmacovigilance
Pharmacovigilance specialist.
specialist. Okay. Thank you.
Okay.
Hi, Swathi. Congratulations.
Thank you.
So I just have one question. So your role, are you gonna work as a fresher or as a senior? Like how many years experience, like in your resume, did you put?
It's senior position.
Like senior?
Swati, how long is your journey from joining the MediPharma to joining the
I finished
job?
my course in March and I took like 2-3 months to prepare. And after that, from June, I started applying. And again, from October, November, there were not many job postings. And January, again, I have applied few, but then I started getting the interview calls.
Or it's
I
been
did
almost
get
10
here
years.
and there, I did get the interview calls, but this was like very quick.
Were you consistently applying or just goofing around?
No.
No.
Remember, Abhishek Garu, when you said there was a student, like past student who applied for like more than 400 jobs and you thought she was exaggerating. No, she wasn't. When we actually did that, now we understood that she wasn't exaggerating. We all did the same. I
See,
think
one
she
thing,
was for
one
500.
thing, one thing good about applying to 400 jobs is not everyone, don't scare people here. But the point is, if you have really applied for 400 jobs, I'm really applauding you and I'm very happy because there are 400 jobs in the market.
Yes.
I don't want to say anything negative there.
No, there are jobs now in the market.
Okay, cool.
It did slow down in October and November a bit. And December, we already know that it's a holiday season, so you don't see much. But again, in January, it's picking up.
Yeah, it is. All right, guys. Just a bigger to go towards the top of the hour. So one final question, and I'm going to ask this question. You're going to hear this question every time we do a success story. Next, I believe the following week we'll have Swathi, another Swathi, I believe. Another Swathi, she's a medical doctor, Swathi Agarwal. She will be on the call, and her story is very as interesting as this Swati's. So you're going to hear from her. But Swathi, what I wanted to ask you is, what are the top three things? I mean, most of the folks on this call are either getting started today or pretty much 1 month into the course. So what do you think will be your recommendation? Top three, 1, 2, 3.
First one, trust Dr. Abhishek. Whatever he says, just go through.
Check this in the mail.
Follow him.
Other than that, just avoid me
And
and just say three things.
just we need to go through all the modules, not just the core modules. Core modules are very important because it gives us the basic idea what the subject is about, but the other self-learning modules, they are also equally important as core modules because they've been asking all the questions from the self-learning modules. But core modules are very important. Unless we know the core modules thoroughly in and out, we won't be able to understand what self-learning modules are. So those are very important.
Okay. Anything else you want to add?
No, if anybody has any questions, that's it.
Dr. Iya, we have a question. I see your hand raised.
Swathi, how many hours a week did you put in study for this course each week total?
It's not like how many hours. Whenever I get time, I used to sit and apply. That's it. Sit, apply, and I used to listen to the modules like on a repeated mode.
Can you hear me?
It was like
Yes,
turned
sir.
on in the morning itself.
Go ahead, please.
Thank you. So I've been running some searches around. I haven't applied for any jobs. So my last search, there was around 137 jobs in the market. That's as of, I think, January 19th to January 20th. Some of them were part-time, some of them were contract, but some of them were full-time with benefits. So this is just to give an idea about when you talk about the jobs. I have a question for Swathi. Maybe I think I should change my name to Swathi since all the Swathis are getting jobs or something. So maybe it is related to their name. Would you say if you answered all the questions in the interview, you would get the job, or there is something that you have to do extra, like going an extra mile to secure the job, other than answering the questions in the interview?
Maybe Abhishek can answer better.
I always say this joke, and it always works very well, Doc. I know this is not the first time I'm telling this to you. Pharmacovigilance interviews are very basic. They're very non-tricky. They just want you to know the basic subject that we repeat again and again in the modules. That's number one. There is no way you're going to not answer a question if you go through the modules diligently. And second thing they want to also make sure when they interview, and that's what I did all these years, is this person going to work with us as a team player? And basically not making sure they're not psychopaths. So that is pretty much what people are looking for in these interviews. They're not really drilling you. There are some people, there was one student had an interview yesterday, and she said they asked 35 questions in like 2 hours. Yeah, there are exceptions. Some people are more into asking questions. But what if I really know the art of interview? I would ask them open-ended questions, make them talk more, and I will listen more. And I would like to know from their choice of words and the way they are communicating, not just the depth of subject, but what is the personality behind this answer. So that's all interview is about. And it's much easier if you are a people's person.
That's actually the hardest.
Yeah, I mean, like, if you're not a people person, I think we all can pretend for 1 hour we are not psychopaths.
Yeah, do my best.
It's all good. It's all good. I mean,
One last question.
most people are nice people. Let me put it that way.
If you don't mind, can
Yeah,
we
Mama.
know your package, Swathi?
Sorry.
Can we know your package? What was your?
No, she's not.
Okay,
Let
I
me take
didn't
that
even start
question.
my job yet.
okay.
I would just
Yes.
ask one question. How much training would they give you on Argus before you actually start working on your own?
It depends. If you have full time, then they might give you for 3 weeks or 4 weeks. But if you are on a contract, they might give you only 1 or 2 days.
Okay, thank
And
you.
it depends on the company also.
Yeah, it depends on the company, doc. All right, guys. We'll adjourn the call now. I know it's almost 10 minutes after 9, but we'll have lot of successes this year. I'm looking forward for this group of students to get into jobs, as soon as March, April. You guys will be done by then, and you will be starting 2024 for us. So just get geared up for what she just said. Go into the modules, do the due diligent work that you are supposed to do, and we will support you as we all are doing for all this time. And again, Swati, thank you for your time. I
One
know.
last question.
Yes, sir. Yes.
I'm going through the modules now, and of course, the first few modules were hard at the time, but now they make sense. They make a lot more sense, and they kind of settle in the brain. How much time do we have access to these modules and this self-assessment thing?
6 months.
Okay.
Yes, doc. So again, it's not like a ideal thing. I mean, it's not like a timeline of 6 months. Things happen, some of you will go through life. We are very considerate on that. But just to give you a ballpark, 6 months is enough time to go through the modules, get a job, and keep moving on. And I always say this, the point of going to a college is to get out of the college, not to stay there forever.
Actually, those were the best days. I wish I've stayed there forever.
Me too. I mean, Mamata can attest to it. Going to the same med school, I would love to go back to 1998, but fortunately or unfortunately, we all cannot do it.
But we'll be very eager to come out of the college then.
Oh, good. That's a total discussion for another 1 hour, guys. But I'll leave you here, but we'll come back on Thursday. Bye-bye.
Thank you so much, Abhishek,
Thank you,
for all
Swati.
your help.
Thank you. Bye.
Thank you.
Bye.
Thank you.